I'm Dr. Emongole. I'm a consultant physician. Today, the 14th of March, we mark World Kidney Day. The theme for this year World Kidney Day is Kidney Health for All. Join us inside as we dive in through the different causes of kidney disease, how to identify them, and how to manage them. Come in. Thank you. Kidneys are small, not quite small, almost the size of our fists. Two of them on the right and the left. They are usually located just below the rib cage on both sides of the spine. They are very important in terms of the function, and they do so many things to our body. Some of these things include they remove the waste product from our body. They maintain the water balance in our body. They also produce hormones that are very crucial in maintaining blood pressure, absorption of vitamin D, and also maintaining the level of blood, what we usually call the hemoglobin level. So when you have derangement in the kidney or something affects your kidney, most of the symptoms will be in comparison to the functions of the kidney. Some of these symptoms include, common ones include you have swelling of your body, and this usually starts on the lower limbs, the lower legs. Usually you also have notice facial swelling early in the morning, which usually resolves as the day progresses. Other things include just feeling fatigued. You can have yellowness of the eye or body itchiness if the liver is involved, both the liver and the kidney. Heart can also be involved when kidney disease is there, and these patients usually have difficulty in breathing when walking. You walk just a short distance and you're gasping for air, you can't go up the stairs, and so on and so forth. So what are the things that cause kidney disease? What actually damages the kidney? There are several things. Some you can't do anything about, like age. As you progress, your kidney lose some of the tissue, and the function usually deteriorates, and this is usually more on people above 65 years of age. Other things that cause kidney disease is when your family members or someone you're related has a kidney issues, and this is what we call genetic predisposition. Infection also comes here. Severe infection can damage your kidney. Any form of dehydration, either from blood loss or not taking enough fluids, can also result in kidney damage. And a condition like diarrhea, which also can cause dehydration, can also result in this. Some other chronic conditions like diabetes, hypertension, rheumatic diseases, connective tissue diseases like SLE or rheumatoid arthritis, all these can contribute to kidney disease. Other things like trauma, someone can hit you where the kidney is, or you can be in a sport that is very contact and physical, like rugby. You can get hit, and it can result also in kidney issues. So regardless of whatever caused the kidney disease, you can either be categorized as an acute or a chronic. Acute basically is something that has been going on for less than 3 months. Chronic usually has gone above 3 months. And it's acute because most acute kidney issues can be reversed with early recognition and early intervention. Like you can be given fluids when you are dehydrated to reverse back the process. Infections can be treated to reverse back the process of the kidney injury. Chronic, on the other hand, most of the time, some or most of all the kidney function has usually been damaged already. So chronic kidney disease is usually classified in stages depending on how much of the kidney function you've already lost. The people we're usually concerned with most, we are concerned with every group because the aim of recognizing the stage is to prevent progression to the lower stage. People who have percentage of kidney less than 15% are those we call end-stage renal disease. And these are the people usually we put on different treatments, both medication to prevent other complications, And as people know, dialysis, these are the people who qualify for dialysis, and also transplant, depending on your characteristics and if you have any other comorbidities. So, who should be screened in our population? Even as you listen to this talk, are you liable for screening or you are okay? So, any person above the age of 65 should be screened for any kidney disease. Any person with the symptoms that are mentioned above, including swelling of the body, feeling of tiredness, difficulty in breathing when you go a short distance, or even yellowness of the eye, you need to come to be screened also. Any other person who has the other comorbidities that I've mentioned, including diabetes, hypertension, connective tissue diseases, like arthritis, you all need to be screened so that we can pick this disease process very early and early intervention to be put in place. In case you are far, you can seek treatment from your nearest facility, a qualified medical officer who will manage you to the best of their ability and might refer you to a physician or even a nephrologist. If you can access a physician directly or a nephrologist directly, the better also for you. So as we celebrate kidney health for all this day of 14th of March, pass this message to your families, to your colleagues, and let's prevent this disease process. As we all know, prevention is better than cure. This is our renal dialysis unit. Welcome. As I mentioned earlier, there are people who qualify for dialysis as a form of treatment, and these include people with the GFR of less than 15, or even people with acute kidney injury with the complication which include uremic pericarditis, uremic encephalopathy, or intractable fluid overload, or electrolyte imbalance. So this is a place where you can get dialysis. We have 3 machines. We have a qualified nurse here on standby, and all this process is covered by NHIF. So if you are near and you go very far for dialysis, welcome here. Thank you.